Hi everyone, and welcome to today's panel on how to make workplace healthcare personalised and preventative. It's great to have you all here today, and I hope you find it an enjoyable and useful session. My name is Jo Pace, and I am the Next and Specialist Primary Care Director here at Bupa in the UK, and I'm responsible, amongst other things, for our preventative healthcare offerings, on-site workplace health, and primary care services. As we all know, the healthcare sector has experienced a rate of change like no other at the moment, with the prospect for personalised health being ever more talked about and becoming more and more of a reality. We recently published an ebook on this topic where, as well as looking at the overall landscape, we had a closer look into some specific areas, namely the impact of genomics on personalisation and what Bupa is finding from our recently launched pilot of My Genomic Health and Health Insights, the importance of data in prescribing personalised interventions for your workforce and individuals, and how working patterns, and in particular hybrid working, changes the interventions and support we need to offer, and how personalising programs to fit with different work patterns and lifestyle routines is really important. So what do we know about preventative healthcare in today's world? Well, at heart of prevention is personalisation, a concept that's evolving in healthcare constantly. The common knowledge is that every person is unique, each with their own needs, preferences, and therefore health risks. By tailoring health interventions to individual differences, it allows to support in a way that truly resonates with the people we're working with, providing them with the appropriate advice and care that's uniquely suited to their circumstances. Due to this kind of personal type, it then helps people to adopt naturally healthier behaviours. By proactively identifying risks and addressing them early, we can reduce the burden of chronic illness, detect and prevent health problems before they arise, and improve health outcomes for everyone. Preventative healthcare is vital for enhancing individuals' well-being and creating a healthier, more resilient society. But not only does personalising preventative health care have a positive impact on the customer experience and the product, it also leads into our business benefit. The impact of personalised healthcare is creating a more achievable and a specific route to creating a healthier lifestyle for customers, which then follows on creating a healthier workforce. And a healthier workforce is naturally more engaged, motivated, and happier, with better turnover levels, lower attrition, and better absence. So, in addition to the general workforce environment, such efforts also help to reduce absenteeism, presenteeism, and the kind of long-term illness that can lead to early retirement. This is really important, particularly given the 25% increase in long-term work absences since the pandemic, and something that I know we're all tackling. On the financial side, the return on investment in preventative healthcare is well documented. This is often reflected in lower health insurance claims through proactive rather than reactive measures. Although I think it's fair to say that we're all hungry to do more to show the correlation and causation between the measures that we put in place and changes in workforce health over time, and how we shape and evolve our use of data will play a pivotal role in our healthcare strategies. With our people spending such a large proportion of their time at work, as employers and businesses, we can make a huge impact in the health of our workforces. We have a powerful setting to support and incentivize our workforces to stay healthy, and are well placed to make the interventions necessary to do so. Bearing this in mind, many employers are embracing preventative health with initiatives like health screenings, wellness programs, and mental health support as standard. These personalised efforts detect early risk factors, encourage healthy habits, and complement more collective efforts like stress management work, team fitness challenges, and the fostering of healthy, supportive workplace culture. This all creates the healthy environment in which our people can flourish. And at Bupa, we're responding to some of those evolving needs, including our recent announcement of 200 mental health clinics globally, 70 of which will be in the UK, which will support the need of those who want mental health support in a face-to-face environment and provide further options to those who prefer an alternative to the remote talking therapies we deliver or do not have access to our workplace mental health services. During today's session, we will be looking at the common challenges that a variety of people face in personalising preventative health and wellbeing in the workplace. These include the need for accessibility, making personalised healthcare solutions available to diverse populations, and the cost implications, managing the costs associated with advanced personalised healthcare technologies. Some of the ways in which we might overcome these challenges and issues include the integration of wearable technology, utilising data from wearable devices to enhance personalisation, the expansion of telehealth and leveraging telehealth for wider access to personal preventative care, and continuous monitoring systems for real-time interventions. So I'm really looking forward to getting into the panel session. But before we start, I'd just like to mention that we have another masterclass on the 3rd of July, focusing on mental health. There will also be an open question and answer session after our panel discussion, so please do pop any questions that you have in the chat. And finally, information about how to access your CPD points will be shown at the end of the webinar, so keep an eye out for that. I'm now absolutely delighted to introduce today's panel. Emily Jones, Client Relationship Director from Broadstone, Katie Duxbury, Head of Pay and Benefits from Bupa UK, and Lisa Aslam, Principal Benefits Manager from Workday. I'll let them introduce themselves properly as we get into the panel session. Right, so let's get to it and on to our first question. So, our first question, what challenges have you faced in personalising health and wellbeing support at work? Emily, should we start with you, please?
Yeah, perfect. Thanks. So just to introduce myself, I'm Emily Jones, Client Relationship Director for Broadstone. I work with a number of clients looking at their needs. I've been in the industry for 25 years, actually started my career over at Bupa. And then I've journeyed through the insurance world and into the broking world. So I'm now on the dark side, as they say, but loving it. And it's great to engage with clients to really understand their needs and requirements. And I think for me, Joe, the biggest challenge that we've seen for most organisations is actually understanding their health and wellbeing risks and needs. And it's actually gathering the data and the MI. And a lot of organisations actually have a lot of this information readily available, but it's finding it and analysing it. You know, they've got numerous policies in force, you know, with health and protection benefits that hold a vast array of information. And it's looking at the claims experience that you're seeing in those policies. What conditions are you seeing? Looking at the trends. So are we seeing over time that a particular trend in a condition or an issue is prevalent? Looking at incident levels for specific conditions. And I think for me, it's interrogating that data, because often, you know, as we know with some of the health provisions, you've got family members covered. And actually, when we're doing analysis like this, we're focusing very much around the employees. So it's looking at the data. What do we want to get from the data and spending time really analysing it? And so those are the insurance policies. But as well as that, and the amount of data that you can have access to is things like usage reports around some of the added value services. You know, virtual GP services are now prevalent in many of the insurance policies. So what are we seeing? And again, are we seeing trends? What are we seeing people using them for? EAPs are another source. So there's a vast array of services that we can get that information from. Once you've obtained that information, you can then look elsewhere in terms of things like MI from screening programs. So again, we find a lot of really valuable information when you look at company-wide programs where you can start to see not only current issues, but actually are we starting to identify future risk issues and concerns. And that's really valuable. Looking at absence data, why are people absent? What's the duration? Is it divisional? Are we looking at particular areas in an organisation? So again, obtaining that information, doing a thorough audit to really understand that. And we know it's challenging. We know with some organisations, it's not always readily available as we would like it to be. So again, can we put measures in place to be able to get that information? Employee surveys are an absolute valuable insight into what our employees are thinking, concerns that they may have, things that they're looking for and their needs. But I think the crucial thing, certainly with any employee surveys, is looking at the pertinent questions. So again, making really specific and bespoke in terms of what you're trying to achieve. Another area that we'll glean information from are benefit platforms. They offer a wealth of analytics. You know, you can start to see the journey that our employees are making. So where are they going? What tiles are they going to? What information are they utilising? And again, using that, you can start to see the engagement that we're seeing in some of the provisions that we offer and take-up rates. Alongside the information that you get from some of the existing provisions and the services and the platforms that we've got on offer is actually just taking a step back sometimes and looking at the demographics of the organisation, looking at the age profile of our company, looking at average age, average income levels that we've got. And these factors will influence the needs and the wants of our employees. So, thinking about external pressures of cost of living, some of the NHS waiting lists, actually, how do those impact the employees, and how does the data that we're getting from our provisions supporting that strategy piece? And I think really valuable, and what we've seen from a lot of the companies that we work with, where they've got wellbeing champions or they've got mental health first aiders, line managers, cohesive HR teams, looking at all that information, pulling that together, looking at exit interviews, what are people saying? Why are they leaving? What are their concerns? Where are the gaps? Really helps to build that strategy piece. And I think until you've got a clear understanding of your health risks, it's just impossible to design a health and wellbeing strategy to meet the needs of our employees and the business needs as well. So I think for me, the challenge often before you start any of these priorities is really understanding your business, and every business will be different.
Thanks so much. And it's we have so much data. It's just really how do we get a hold of it and use it properly. Katie, I know you have a different set of perspectives on this. So what challenges have you faced? And can you introduce yourself?
Thanks, Jo. So I'm Katie Duxbury. I lead the pay and benefits team here at Bupa. So I have the lovely relationship of Bupa being my employer, but me also being their client and a buyer of services for our employees and colleagues. And a lot really to echo the points that Emily made. I think one of the challenges that we face as an organisation specifically is the fact that we are multi-sector. So how do you put a healthcare package in front of different styles of workers across different sectors and stay competitive and make sure that you're giving people the choice and the agency that they would like? I know definitely coming out of the COVID years, mental health and musculoskeletal were our two biggest reasons for people being out of the office, both our office-based people and our distributed workforce at our care homes and our dental practices. But we had really low take-up in those distributed teams of the healthcare provision that we were making available for them. So that was the kind of the trick that we needed to crack. And I know we're going to come on later about how we managed that and how we navigated that. But it's how do you do something across thousands of people and maintain that level of personalisation for the individual that really needs that care at the point of need.
Thanks, Katie, and such a diverse workforce. So, Lisa, coming on to you. So what are the challenges that you face in personalising your health and wellbeing support?
Thanks, Jo. Yeah, I'm Lisa Aslam, the Principal Benefits Manager for the EMEA region here at Workday. I've been at Workday about 9 years. So we've grown massively in that time, from 4,000 to 20,000 employees. So challenges that we face, I would say, first of all, data privacy and ethical considerations are obviously paramount. At Workday, we place a very high priority on protecting employee data privacy and creating an environment of trust so that employees know that information will be handled securely and ethically. So it's essential for us to hold all of our vendors to the same high standards. We factor that into our vendor management process, which obviously means that can take a bit of time and can be challenging for the vendors to complete. But it's very important to us to get that right. And then achieving genuine personalization at scale in a multinational company can obviously be very complex. So there's a few kind of key principles that we have within our team. We always just design our healthcare benefits with inclusivity in mind. So at Workday, we say that we value inclusion, belonging and equity. We also consider employee communications to be of equal importance to the benefits that we're delivering. So we consider the storytelling and the people leader engagement to be particularly powerful to normalize our offerings. Employee experience is central to everything that we're doing. So a really important part of this is making the solutions convenient and easy to access. I think convenient is really the key point there. And then no big surprise to everyone, but all of our benefit programs are very efficiently managed in Workday. And finally, employee engagement and buy-in is crucial. So even with the best kind of fully funded, personalised offerings, if the employees aren't actively participating or seeing the value, then the impact's going to be limited. So fostering a culture where seeking support is encouraged and prioritised when everyone's really busy takes time and effort.
Brilliant. Thank you so much, Lisa. It's so important when you've got a range of benefits to make sure that people are actually properly accessing them and there aren't hidden barriers in the way. So it's great to hear. So on to our next question. So back again. So what have you done to encourage change? And Emily, will start with you again.
Yeah, brilliant. Thanks, Joe. I think for me, once you've done your analysis, and I referred to it earlier in terms of the deeper dive, really understanding the organisation, the strategy, identifying the gaps and the future health risks, it is quite evident that every single company that we do that with is so vastly different. And it might be just their business goals, or it might be where we've identified risk exposures. So it certainly makes my job interesting and often challenging, because they're different risks that are presented to us. And I think if I take you through maybe one example of where we've supported a client, just so it brings it to life a little bit. We did an audit with a particular client. They had identified that they felt they had some issues in terms of the disconnect with their employees. They'd gone through a number of recent acquisitions in quite a short period of time. So I think people were just feeling a little bit despondent, didn't feel valued, that they could start to see some silos forming of old acquisition companies and sticking with their original colleagues, and actually wasn't going to be very fruitful for the business going forward. So we commenced a full audit with them, reviewed the MI, looked at some of the issues that they'd highlighted, and very quickly it was quite evident where the gaps were. So we drafted a paper, pulled together some of the risk exposures, some of the financial impacts to the business, areas of just general concern and feedback that we felt, but then presented that to the key stakeholders. Because I think for me, unless you get buy-in from your stakeholders, I think you're always going to struggle with any strategy. So we made it very coherent, presented to the stakeholders, and actually we very quickly got their buy-in. And I think the solution for us then was to look at a wellbeing framework. So we wanted to enhance the wellness culture and the sense of belonging within the organisation, and reduce some of the future health risks that we'd identified when we'd done the initial review. So we reviewed all of their available services, and they did have a number of insurances in place, and there were many provisions that were available to them. And I guess we made it easier for them by using pillars to fill those resources. So looking at things like financial well-being, physical well-being, mental health well-being, and actually looking and identifying those provisions and filling up those pillars. And actually where we saw pillars that didn't have enough, those were the areas that we needed to focus on and ensure that there weren't any gaps and exposures. We identified there was a number of areas that the existing providers actually were able to help us with. So actually some of those resources were free and available. So we introduced those and they went down really well. But unfortunately, as good as Bupa and others are, there were some gaps as well. So that's where we then stepped into looking in terms of external partnerships to look at how we could complement some of the provisions that they were already accessing through the likes of Bupa. We appointed wellbeing champions, which I think, again, for me, is a crucial part of any proposition and strategy. So they were going to be the voice of the stakeholders. They were going to articulate the new proposition that was going out, ensure that we get full engagement. So communication was the key factor here. We mapped out a calendar for the year, looking at some of the key national dates, but also some of the key business dates. So thinking around things like salary increases, how are they going to impact? Where do we factor those in? Looking at benefit window selection dates. So actually, how does that implement in terms of our communication strategy? Once we'd done that, we then looked at the benefits platform, how we were going to use that to really start to engage with with the employees. We created some AI videos, made them quite personalised. So again, reaching out to the audience and thinking of different mediums. Some things landed really well and we got great engagement. Others didn't. So we revisited those and looked at different ways that you could actually get people's buy-in. And again, it's about getting regular feedback. We engaged with the wellbeing champions. We had regular meetings and looked at new initiatives and got their support in terms of any launch. And I think the crucial thing in terms of buying from the stakeholders meant that we were then able, when we identified some of the key risks and for us, in terms of health checks and understanding the general health of our employees was a fundamental void in the MI that we had. So again, we presented that back to the stakeholders because we'd started the journey by engaging them. They were more than willing to put financial support behind it. So I think for me, a roundup is the communication is absolutely key. And I know Lisa mentioned it earlier. It is, because without that, you will not get the engagement and you just won't reap the rewards of all the good work that you're doing as an organisation.
Fantastic, Emily. That was such a comprehensive plan you had there. Katie, moving on to you. What did you do to encourage change?
Yeah, so we think I'm in a really privileged position in that trying to get funding at a board level, I am literally preaching to the choir because we're in that industry. And so there are no barriers there, which is awesome. A few years back, we did do a huge listening exercise to understand how we make sure that our frontline team, so our people particularly in care homes and dental practices, have got access to the healthcare that they need. And whilst we'd originally thought that a private medical insurance type product would be the thing, that wasn't the information that we got from the listening. And what we heard was that they were struggling to get GP appointments, they were struggling to visit physio appointments, they needed support with mental health. So what we did was we built a package of interventions that created that primary care access, so virtual GP, virtual mental health experts, virtual physio, to meet that need in line with variable shifts, working, 24/7 businesses, very difficult to be available for a GP in the hours that they're available through the NHS. What we also provided was some options around an allowance each year. So that could either be used to buy into a cash plan that could be used as a traditional cash plan opportunity, or if the person had some really specific concerns, they could go and get a clinical appointment, so potentially to look at cancer risk, for female and male cancer risk, etc. So again, the choice was put in front of the individuals. What we did find when we did this, and it's interesting, isn't it, the role of communications and the way that you put these benefits in front of colleagues, there was a significant mental barrier from our frontline employees of, we don't normally get this kind of support, so this can't be for us. So even though we were sending the comms out and it said, words like everybody and all, there was still this kind of mindset barrier. So when we launched this, we did this with a group of roving wellbeing advisors who went and visited literally every care home, every site that we've got across the UK and beyond, to go and eyeball our people and say, no, it is definitely meant for you. This is definitely a benefit that you can access. Please do so and we'll help you do that. And that was amazing. That really got us a step change. So as an example, the cash plan, we got a 400% uplift in people opting into the cash plan as a result of that hands-on one-to-one care. And then last year, we supercharged this by putting it on a technology platform, which again is putting it in people's pocket from their mobile phones, allowing them to access services without having, potentially an embarrassing conversation with a manager and having the manager show them the route to get that support. They were able to do it using their mobile phone and, without any, conversations necessarily. And that, again, with the statistics from launching Viva Benefits, which is the name of our platform, were just phenomenal. And we're about 12 months in now, so we're continuing to listen and we're continuing to iterate. One of the things that we've just refreshed recently, so we had a remote health assessments for one portfolio and in-person health assessments for another portfolio. And what we found is that actually it's not always needed to be face-to-face, and some of our colleagues would like to just be able to do a remote health assessment. So we've now made that interchangeable across those two cohorts of staff. Again, that came out of listening, a big listening exercise that we did. So there's a lot more that we can do. And again, reflecting on both Emily and Lisa's point, being really close to what people need and want and meeting that need head on as quickly as you can when that need kind of arises is really important. I don't think there's ever an opportunity to like rest on your laurels in this space, because needs change so frequently. And, just a government announcement and news headlines can really drive, mental health pressures and support that people need. So yeah, I think we've done a lot in that space, but it still feels like we've got the same again to do to continue to stay relevant and up to date.
Thanks, Katie. Yes, it's really important to design our solutions to meet, especially such a workforce with such varied working patterns. And then, Lisa, finally, what have you done to encourage change?
We had a look at our high-risk healthcare areas, and we've really sought to find some convenient preventative solutions for people. So we have added some on-site physiotherapy, and we've also got a one-to-one nutritional support for diet and lifestyle advice, access to a sleep coach, and workplace mental health consultants who are on site as well. And that's worked really well for us, just to make sure that these experts that are delivering the services are well known within the business. And of course, we also benefit from word of mouth referrals between employees. Most of the services are also offered out regionally, because they can be done remotely. And we've had to make some adjustments in terms of the availability of the appointments according to demand. So there's been a bit of trial and error on what we need to provide for those services, but that's been very effective for us. We've also got telehealth solutions available globally. We've learnt that actually making sure that they're a local provider increases engagement. We also have access to women's health and family support through telehealth solution. And then we internally created a Jack at Workday mental health platform, which is just ask a question, where we filmed with our leadership and our EBC members and some of our vendors actually, and rolled that out across the UK and Ireland. One of the driving factors for that was the volume of wellbeing webinars that we were promoting. And what we find with the Jack platform is it obviously simplifies the ability for our employees to find information on key topics like physical health, mental wellness, neurodiversity, diversity and inclusion, and quickly get to the information they're looking for. So we really wanted to give people time back in their day, so that they can actually then take advantage of these personalised preventive solutions that we've put in place, and also attending those health assessments as well. So we've actively really limited the number of events that we're pushing into calendars, just to make that time for people. We've also empowered our local wellbeing leaders with resource toolkits to encourage them to create impactful kind of relevant events, such as watch parties. We had a great example of this hosting a managing menopause symptoms at work event, where we had some menopause friendly snacks, which just created this fantastic knowledge sharing environment session. So that's the kind of thing where we want to encourage, where we get full engagement and participation in the session, that people find really useful. We've also partnered with some cancer experts to create globally relevant prevention and support information. So just very quick 60 to 90 second videos and short information articles. And we've also collated resources which can be of interest to specific communities. And we've delivered these through articles on our benefits site. So for example, we have one that's called Supporting You to Be Your True Self, so LGBTQIA plus benefits. So, really just helping to signpost people to information resources that are relevant to their personal circumstances. And then we've built this external facing benefits site, which is obviously easy to use and access from anywhere for employees, family members, talent, and our alumni as well. So that, if anyone's interested in having a look, that's benefits.workday.com, where you can see the articles that I mentioned. You can see the cancer resources that I mentioned as well, and just how we've displayed all of our benefits just to make it easy for people to find. We also have an AI translator on there to put that into different languages. In terms of changes within Workday itself, we obviously use the latest Workday benefits technology, and we've created some very engaging benefit cards, which showcase the offerings to our new hires during annual enrollment, during change events that we call moments that matter. And we've also embedded reminders of relevant support through Workday journeys, which are tailored to particular leave types. We also leverage Workday knowledge articles, which really can help with just improving understanding of benefits, self-service empowerment, so reducing the case creation. And there is some AI capability there as well to help just create articles for employees more easily. And then from a health assessment perspective, we've added male and female fertility testing in the UK as an alternative use to the annual health assessment budget, just to support understanding fertility status and family planning. And that's been very well received. And we've actively streamlined the number of choices that are available just to make it quick to make a decision leading to an action. At one stage, I will say we had too many health assessment types on offer, and that did lead to a lower uptake. So a bit of a lesson learnt there. And I hope that helps other people on the call.
Brilliant, Lisa. Thank you. And obviously, you spent a lot of time really honing your consideration of how you get the best engagement with the things that you offer, which is fantastic. So just before we move on to the next question, just another reminder that we will have a Q&A session at the after the panel session, which is after this question. So please do get your questions in, and that would be brilliant. So on to our final question, and back to Emily. So having done all of this, how do you help your clients measure success?
Thanks, Jo. It's often really difficult to measure return on investment for wellbeing initiatives, and I think that's always been a challenge. We've often used absence data, stats, and figures to articulate the benefits, but I think there are other measures that you can use to be able to articulate whether a proposition has been successful and a strategy has been successful. Looking at engagement stats, thinking about how the usage initially before you launch the program, I think is often key, because we often get the stats once we've run the program for a number of months. But actually, if we can do this properly and do the initial audit, understand then where the usage is, but follow it through in terms of the activity, the launch, and now what are we actually seeing? We can start to see whether something was successful or not. Regular analysis is key. Looking at, as we mentioned earlier, around things like platform and analytics and where people are accessing is crucial. So you can start to see a journey of an employee. You can start to understand whether what you're putting in place is effective or not. And again, it's about revisiting that and saying, actually, should we do something different? Is it not quite hitting the mark? So the other thing to obviously look at is the absence records. And again, that's doing the analysis around the exit interview. So what have we now seen? Have we seen the changes from what we used to see? And actually, are we seeing that people are more engaged, but actually these other factors? So again, continually revisiting. Employee satisfaction surveys are a crucial thing. And I mentioned it earlier in terms of the pertinent questions. So again, making sure that we keep some consistency, and then we can start to do the analysis of those. And actually see the evidence of some of the programs and the strategies that we put in place. And I just think it's really important, really, for all the actions that we take now. You are future proofing the well-being of your employees. You're putting in robust preventative and supportive pathways will help guide and support individuals, and certainly help identify and manage some conditions earlier. which does help reduce financial burdens. So I think it's just really important that you don't just use one analysis in terms of return on investment. Look at a number of areas. Starting point, where have we journeyed? What have we seen? Feedback is absolutely imperative. But again, this is, this is an ongoing strategy. This is a personalised and effective health and wellbeing strategy is a long-term plan where you will continuously adapt as things change. We've seen, as we went through COVID years, changes happen. Our employees, as we see, I mentioned earlier about my client that I work with, where they'd acquired new businesses, their environment changed. So this is about constantly revisiting this and seeing and identifying it. And as we mentioned, I know, Katie, you've got an open door, but not every client does. And it's about reporting back to stakeholders. This is what we're seeing, and this is the evidence. So that's how we support clients.
Brilliant. Thanks so much, Emily. So, Katie, how do you measure success?
Yeah, and again, Emily, all of the above. So staff surveys are great, aren't they? The before and after statistics are also great. So you can kind of look at the hard maths. I think listening to the softer narrative, the feedback that we're getting through our reward business partners, through our managers on the front line is also really important. I think what we've found really useful, and there's a real balance between being in this for the long game, because when you're influencing somebody's health, it's very often a long-term picture, isn't it? Especially around mental health as an example, but then also staying agile enough to iterate and change as you go. So there's a real balance there. But I think it's also useful if you can identify a business-led KPI that you can then see a line of sight to. So one example of that, when we picked up the financial wellness space around 2019, we really wanted to go after our agency spend, specifically in our care homes. What's really important to us in the care home environment is that we use our substantive people as much as possible, because that provides great continuity of care for our residents, especially in that dementia space. It's really important, and it drives the right clinical outcomes in that portfolio of people. So reducing our agency spend and allowing our existing staff to pick up extra shifts, to be healthy at work and more present at work was really important. And we can see that line of sight now through the two main initiatives. So My Healthcare, which I spoke about earlier, and a financial wellness program that we started in 2019, we can see a lovely downtrend of agency spend, which then helpfully gives us more available budget to push back into that healthcare space. So I think sometimes, and again, I do have an open door and I'm very privileged in that sense. But I think if you can really focus on a business-led statistic and show that change, then your business leaders are already over the line at that point, because they can see that direct line of sight.
That's absolutely fantastic, Katie. I love that. I love that idea. And Lisa, final one to you. So how do you measure success with all that you've done?
So we use anonymized aggregated insights from workplace data through Workday, including the employee feedback Peakon survey tool, which includes an AI summary of the comments, which is an absolute game changer. So we can very quickly see what the sentiment is. We have the health assessment report summaries, which identify high-risk areas for us. We have the medical claims data. We also have visits to the benefits site, which give us a good insight as well. And then we have the Jack dashboard, so we can understand broader trends around what people are interested in. So we have visibility that the health and wellbeing score at Workday is currently higher than the industry benchmark. We're achieving lower than average sickness absence, fewer high cost claims on the UK medical programme, although what we are seeing is a high volume of claims generally due to the NHS waiting times. And also, I would say it's driven by the increased use of the online doctor benefit. We do have a good high use of preventative dental engagement. Specific health improvements that we've made, just to give a couple of examples, on the MSK, obviously I mentioned the on-site physio, the percentage of employees experiencing pain or reduced range of motion has significantly reduced. So, there's a significant increase in the number of employees who are reporting no pain or dysfunction, and then cardiovascular disease percentage of employees who are at high risk decreasing year over year. So we can see that the programs that we've put into place are having the desired effect. And we've got really good insight on the wellbeing topics, which obviously currently of interest, and we continue to focus our efforts on those in terms of preventative health priorities.
Fantastic. Thank you so much, Lisa. Well, that ends the warmed up part of this channel, and we've moved over to questions and answers. And thank you very much for those people who have submitted questions so far. Please keep them coming. But we start with one for you, Emily. What more can your account managers do to personalise your health and wellbeing strategies in the workplace to add value to our partnership?
Yeah, absolutely. I mean, I think, again, that's coming back to that open dialogue. So as an organisation, what are you trying to achieve? Have you identified pinch points? I know I've mentioned it again with regards to audits, but again, it's really just valuable to really understand what position you're in, what your risk exposures are, what benefits you can introduce, and how they will support your future strategy. But I think working with your current providers is key, because they offer so much in the way of valuable service and support. So it's really working with them closely, understanding everything that they've got on offer. I mentioned it earlier with regards to there's a lot of employee support, but also line manager support. So again, it's utilising that, because if we can train and support our managers, they can help and support our employees. So understanding what your providers offer is the crucial journey that you should embark on. And then from there, then understanding, are there other areas of concern that certainly your intermediary or your insurer can develop and provide you with.
Thanks, Emily. And we've got one directly for you as well, Lisa. You've spoken a little bit already about your use of Jack, but it's at least we know that Workday used Jack. Could you tell us about that, about how that's gone?
Yeah, very well received by our employees, very well supported by the leadership. In terms of what content was of most interest, it really was listening to people that are from the business, discussing their own mental health challenges. I think that really does help to normalize the conversation and make sure that people know it's okay to access support, but also understanding what techniques people use to help them manage their own mental health. It's really interesting to see what works for different people, and so yeah, so far so good. In fact, we're actually launching in Denmark next month, so.
Oh, fantastic. Well, that is exciting. So the next question is, have any of the panelists built preventative wellbeing into their existing people management processes? Katie, should we start with you?
Yeah, and I think it's another topic where it's a really tricky balance, isn't it? Because when something's really quite so personal, the individuals don't necessarily want to have that as part of a conversation with a manager or another, a forum that kind of exposes them, I suppose, and makes them feel quite vulnerable to have those discussions. So we absolutely provide education for our managers to make sure that they are spotting areas that might be mental health triggers. We have our Healthy Minds line that managers are very familiar with and can refer their colleagues to that. I think what we also try and do, so we have the Jack platform, is to provide as many opportunities for the employee themselves to access the care and support that they need. And I think that in itself just kind of acknowledges that there are barriers there to people reaching out and asking for help. And if they can do that in a virtual way, in the privacy of their own home, without having to, surface that concern. So I think, again, it's a tricky balance, because we want managers to have a finger on the pulse and understand what's going on with their teams. But we also don't want them to be the gatekeeper and that provide a barrier that is unnecessary fundamentally.
Lisa, Emily, do you have anything that you want to add on this one?
I can go, Lisa. Yeah, I think in terms of it, and we've referred to it earlier, it is massively important to ensure that people are equipped to deal with these situations, and you know, often as Lisa and as Katie said, in terms of identifying, you know, where somebody maybe is struggling, and actually, you know, we have many webinars that are available through, you know, providers like yourselves and others that do equip managers and training courses that are available. So it's really important to take advantage of those. But it also just to have that open dialogue, I think is just really crucial. And I think with any framework, the manager component is a vital part of that.
Yes. Brilliant.
Yeah, I would just echo what Emily said there. In terms of, we do similar to provide the support for our managers and really fundamentally make sure that people feel comfortable having those conversations, which, as I've alluded to with the Jack platform, has helped.
And actually one that sort of follows on really in terms of how we access our how our people access our benefits for the younger generation starting work. What changes in benefits do you think will be crucial? Lisa, what are you seeing? What are you seeing in Workday with and in terms of your engagement?
Really good engagement with preventative solutions, actually, from the younger generation. So, it's still massively of interest to undertake those full health assessments. It's definitely not something that is exclusively appealing to the older workforce. So, obviously, I think, you know, digital first, in terms of the solution, that again, making it convenient, easy to access, all super important.
I've just got a comment on that one, Joe, in terms of the younger, and I mentioned it earlier, demographics. It's really important to analyse, you know, what needs some people will have, and certainly, yes, for the younger. I think we make some suggestions of what they might like, but actually it's often surprising when you offer a benefits platform and give them choice and selection of what actually they do take. So again, it's about choice, and it's just about making sure that you are giving access to provisions and services and support for you know, for the wider demographics, as opposed to just pigeonholing and assuming that certain individuals will want certain things. Whilst we may be a certain age, we may want different things out of life.
Thanks, Emily. And so questions are flowing in now, which is fantastic. As a business, we are frequently being asked to support chronic cover within our PMI scheme. I'm interested to understand what the panel do within respective businesses and how this links to personalised preventative strategies. Katie, should we start with you on this one?
Yeah, so we've just recently removed kind of pre-existing conditions from our PMI benefit for this very reason. And we've got a number of things in place to help people stay in work as much as possible alongside those chronic conditions. So I think, again, there's elements of kind of the way that we do business, I suppose, that is really important here, providing flexible working opportunities, making sure that there's adequate time away from work facilities, whether that's, you know, people that have caring responsibilities or activities with children, just making sure that they're not kind of burning the candle at both ends. So as far as accessing the preventative care, that's now in our PMI policy. But there's a kind of a wider issue, isn't there, in the way that people arrive to work and how we care for them in that broadest sense, making sure they've got the facilities, that we are making our environments accessible if there's mobility issues. So it's quite a broad, you know, D&I question, that one, as well as the preventative health space.
Lisa, have you got anything to add on that question?
We also cover pre-existing conditions. We've created a trust for our medical plan. So We do have full coverage there. And just on the caregiving front, I would say we have a caregiving concierge service, which is phenomenal for anyone who does need that extra support in terms of booking regular medical appointments, etc. It really does take a weight off.
Oh, that's fantastic. Thank you. And actually, a slightly linked question. Are you aware of some of the free wellbeing benefits available via group life and income protection policies that can help take the strain away from the PMI scheme, including virtual GP, remote physio, EAP, amongst others, etc.? Emily, how do you balance what goes?
Yeah, it can be a minefield, and I think there are, as I mentioned earlier, there's so many provisions available through all providers and services. So trying to navigate it is sometimes challenging, but again, that's then the ownership of if you've got a supportive intermediary to help and guide you through the provisions, and they sometimes are different in terms of what they deliver and what they actually offer. So again, it's about looking at each of your provider, looking at what's available, what access do you have? Is it for employee only? Is it for inclusion of family members? So it's doing an analysis of all of that, deciding as an organisation which ones are you going to promote, and which ones will be available via other resources. And then again, thinking about the webinars, about building those in. And we talked earlier around the wellbeing calendar. That's really important. And if you can engage with some of the providers and actually start to plot in some of those services, when are they going to be? When are they available? How do you register? And again, in the communications package. So it just makes it easier to navigate your way through and journey. And we talked about pathways. I know, Lisa, you mentioned that. And again, it's about making it easy for people to access services. Where do I go to if I need support for X? Where do I go if I'm challenged with so it's really it's the communication and the education piece. But it's really, like I say, there's so many free available services that we have at our fingertips. So it's doing the analysis to understand which ones of those and you said, Lisa, earlier, sometimes you can overcomplicate it. And that does happen when somebody's got access to 3 virtual GP services or 3 EAP provisions that are available. How do we help people navigate their way through what can be a challenging time for them?
Yes, there's a lot on there really. And actually, Emily, one last question for you, which is, are any providers offering PMI, mid-range care and cash plans under one provider to enable choice and personalised benefit, as well as for a small business, removing the impact of large claims for a small population?
In terms of provisions, and obviously, yes, you've got a number of providers who can offer both solutions. And again, it is looking at that. How do they complement? Because you can, and we've done it before where we've worked with clients where they've acquired so many different benefits because they've acquired more and more organizations, and actually that they don't complement each other. They conflict a little bit. So again, that's taking a step back to look at harmonization. How can we utilize some of the provisions, some of the services, some of the insurance products and policies, and how can they work together effectively? Which then, when we talked about return on investment, that's looking at the financial implications of that. So, how can they work to help reduce some of the risk exposures? And absolutely, some provisions do help because they're future-proofing others and they're providing that preventative strategy. So, yeah, absolutely. And it is about looking at what you're putting on offer to your employees.
Thank you. Thank you so much, Emily. And thank you very much, Katie and Lisa as well. That's all we've got time for, but it's been a really fascinating discussion and I've learned a huge amount and really impressed with all the activity that's going on everywhere throughout the sector, as we know. So I just want to say a huge thank you to everybody for joining. If you want your CPD point, then email insights@bupa.com with your full name and reference to get there. As I mentioned in the middle of the session, our second Masterclass will be coming on the 3rd of July. There is a QR code there for you to sign up, and I believe a link will be put in the chat. And look out for our next ebook, which is Mental Health at Work: Creating Supportive Workplaces. But other than that, just a huge thank you once again to my panelists, and a thank you very much to all of you for joining.